How many LDL particles do I have in my blood? You know, the quote, bad cholesterol that transports cholesterol molecules to body cells that can make plaques bigger and heart disease worse. How many HDL particles do I have in my blood? Those, quote, good cholesterol particles that take cholesterol to the liver to be destroyed and reduces heart disease risk. Well, these levels are in part dependent on my diet. How much fat and cholesterol do I eat? How many calories do I burn? HDL levels increase with exercise and good cardiovascular health. And so there are a number of environmental factors which determine the levels of HDLs and LDL particles in my blood. There are a number of genes which determine how many LDL and HDL particles I make and how well they work. And so there are variations in the apolipoproteins which occur in these particles, such as apolipoprotein B in the LDL particles, or apolipoprotein E in the HDL particles, or the receptors that bind to them, such as the LDL receptor, whose mutation causes familial hypercholesterolemia, or the pump called ABCA1, whose mutations prevent cholesterol from being pumped into HDL particles and thus cause Tangier disease. There are a variety of variations in these genes which can therefore affect the transport of cholesterol and how many LDL and HDL particles we possess and how well they work. And thus, genes and environment help to control the levels of LDL particles and HDL particles in the blood. And it becomes a question, which combinations of genes and environmental factors are present? Good genes might compensate for a poor diet. A good diet might compensate to some degree for poor genes. And so, not only are there genes and environmental factors, but these factors interact to help determine the risk of heart disease determined by the LDL and HDL particles.